The Avelle Negative Pressure Wound Therapy System mode of action, surgical incisions. Surgical interventions are increasing year on year, and a substantial number of patients develop surgical site infections and other incisional complications which pose a threat to patient outcomes. These surgical site complications, or SSCs, can include hematoma, seroma, dehiscence, and blistering. Surgical site infections, or SSIs, can be defined as infections occurring up to 30 days after surgery. Up to 50% of SSIs occur post-discharge. SSIs affect up to 1/3 of surgical patients and account for 18% of all healthcare-acquired infections. For patients, this means delayed wound healing, impaired quality of life, increased length of stay by up to 10 days, and 5 times increased likelihood of readmission within the 30-day post-op period. SSIs almost double healthcare-related costs and are associated with €19 billion of extra costs in the EU and at least $10 billion in the United States of America. However, 60% of SSIs have been estimated to be preventable. Choosing the right incision management system can help you to reduce surgical site complications, length of stay, readmission, additional intervention, and community nursing resources. Traditionally, surgeons close surgical incisions by primary intention, using sutures, tissue adhesives, or staples. Closed incision negative pressure has emerged as a prophylactic option for high-risk and high-consequence patients, in order to reduce the risk of surgical site complications by reducing incision line tension, decreasing oedema, improving lymphatic drainage, providing a physical barrier to external contamination, and improving scar quality. The Avelle Negative Pressure Wound Therapy System is designed to manage surgical incisions and a broad range of other wound indications. The Avelle system consists of a non-sterile, single-use pump supplied with tubing and 2 sets of lithium AAA batteries. Avelle dressing packs include a Hydrofiber technology negative pressure wound dressing and 6 fixation strips. The Avelle pump is small, portable, and powered by lithium batteries, which enables up to 30 days of therapy and delivers 80 millimeters of mercury negative pressure therapy to the wound bed. The pump is operated by a single blue button and has 3 indicator lights to signal the system status. A green flashing tick light signals the pump is operating correctly. A yellow flashing exclamation mark light signals an air leak in the system. A yellow flashing battery light signals that batteries need to be replaced within 24 hours. The interactive Avelle dressing includes a Hydrofiber technology interface, which has many clinical benefits and has been engineered to deliver negative pressure to the wound. On application, the Avelle dressing should be positioned with the port over intact skin and uppermost from the incision. The perforated silicone adhesive borders secure the dressing in place while being gentle to the skin during removal. Ensure the border is smoothed out to minimize air leaks. Fixation strips can be applied with a 1 centimeter overlap to all sides of the dressing in order to maintain the seal during the wear time of the dressing. When the dressing has been applied securely, the pump can be turned on. As negative pressure wound therapy is applied, air is withdrawn from the dressing, causing it to flatten. The Avelle dressing is designed with a Hydrofiber technology wound contact layer, which gels on contact with wound fluid and is stitch bonded to maintain integrity on removal. Traditional wound interfaces such as foam, gauze, or perforated silicone provide a passive contact surface with the wound. The adaptability and conformability of the wound interface is important to reduce dead space and limit free fluid collection harboring bacteria. On contact with the incision, the gelling effect of Hydrofiber technology locks in and traps wound exudate and bacteria, whilst micro-contouring to the wound bed, minimizing dead space where bacteria can grow. Wound fluid is transported into the inner Hydrofiber technology layers of the dressing via vertical wicking. The 8 layers of hydrofiber technology within the dressing gel on contact with wound fluid and lock in bacteria, keeping it away from the wound bed and surrounding skin. Fenestrations in the hydrofiber technology layers are designed to promote vertical fluid movement throughout the dressing. Histological studies prove hydrofiber technology supports wound healing processes by allowing a fibrin layer to form between the dressing and the wound bed. This creates a physical barrier which prohibits macrophages from being absorbed within the dressing, allowing them to rebuild tissues and produce growth factors promoting collagen production. This is crucial for improving healing and scar formation. Hydrofiber technology gels when in contact with wound exudate. In vitro studies prove hydrofiber technology sequesters and immobilizes microorganisms associated with SSI within the dressing, such as Staphylococcus aureus, Pseudomonas aeruginosa, and E. coli. The foam layer within the Avelle dressing aids distribution of negative pressure across the dressing and to the wound bed, whilst the backing film permits evaporation of exudate, aiding the overall fluid handling. The backing film also provides a bacterial, viral, and shower-proof barrier. The dressing connector consists of a one-way valve, which maintains negative pressure at the wound for 1 hour after disconnection from the pump, enabling patients to shower whilst therapy is delivered. The Avelle Negative Pressure Wound Therapy System offers a range of benefits for the management of closed incisions. An all-in-one dressing available in a range of sizes to suit a variety of surgical applications. Hydrofiber technology which gels on contact with wound fluid and locks in bacteria, keeping it away from surrounding skin. A viral, bacterial, and shower-proof barrier to protect the incision from external contamination. Negative pressure wound therapy delivered at 80 millimeters of mercury for continuous therapy to the incision. A small, portable pump which allows patients to stay active to aid recovery and rehabilitation. A pump with a 30-day lifespan which allows delivery of negative pressure wound therapy immediately after incision closure, through to the time point to remove stitches or staples. Convatec also offer a range of negative pressure accessories that can be combined with Avelle, including a carry bag for the pump, spare tubes, and hydrocolloid sealing strips to aid the dressing seal in difficult-to-seal areas.